Hello my people, welcome back to my YouTube channel. Karimi Nduma here. I'm back again with another content. So on today's video we're going to talk about acne again. Yeah, and as you can see today I don't have a bare face. Well, this question has been going around too much. Like, many people keep asking me, what is acne? What is it? What causes acne? Such questions. Today, stay tuned. I'm answering all your questions. So to start with, I'm having my notes down here, so I'll keep checking on them. Yeah, because I've done some research about acne, and because I wanted to give an extensive knowledge of acne, not basically what I am fighting, because acne is of different types. So to start with, what is acne? Basically, acne is a disease consisting of blemishes that can occur in your face, chest, shoulders, or the back. It is very common, actually. Acne is very common during the adolescence, and also it can go up to adulthood. So it is not necessary. It does not necessarily affect the teenagers. That is something you should understand. And again, what causes acne? Here is where there are a lot of myths about that, but basically, what causes acne? Acne can be something caused by bacteria, it can be certain medications, or it can be genetics, or it can be hormonal. And there are two types of acne. We have the non-inflammatory acne and inflammatory acne. That is something you should always know. So basically, to understand acne, you should understand your skin also, because as you know, the largest organ of our body is the skin. So we get to understand something little about the skin. First of all, our body depends on sebaceous glands, which is under our skin to keep our skin lubricated. Again, the sebaceous glands secrete sebum, that you all know. The sebaceous glands secrete sebum, which prevent our skin and hair from drying. So sometimes when our body produce excess sebum, and the dead skin cells, they stick together and clog our pores, resorting to what? To blemishes. You all know our bodies has pores. So when you have clogged pores, they resort to blemishes. Or how do they resort to these blemishes? They resort to blemishes because inside our skin there exist small bacteria in small amounts, which can flourish when the pores are clogged, leading to inflammation. So depending on the clog and where the clog is located, the inflammation now, which is the acne, which appears, it can appear anywhere now in the skin, either as a white hand or a blackhead. The blackheads are clogged follicles that turn more darker, and the white hands are clogged follicles, which can result to pimples, cysts, or pustules. Pustules are the pimples in another name. Like you see, the pimples sometimes have pus, others are just big lumps over over the skin. So they just come out in different types. Again, I talked about hormones. Hormonal changes, particularly the rise of the testosterone. We all know about the hormones. The hormones we secrete. I'll not go deeper into that. So, if you produce more testosterone, it can lead to overproduction of sebum, which is the hormone that triggers the cause of acne, mostly during the teenage age. Sometimes you keep hearing people say, I have acne, but I don't know if it's hormonal, I don't know if it's reaction or what, So it's better if you're fighting acne, it's better you go back to your memory lane. You get to understand how this started. That is it. Because like for me, it's not something genetic, because in our family, no one, like basically in my family, my parents, my siblings don't have acne at any cost. They just have smooth faces, flawless faces. I'm the only person who suffers from acne. I can't say it's bacterial, because when it's bacterial, it's somehow easy to treat, and it's not certain chemicals. Mine, it's hormonal, because at times my face clears and then erupts again. Especially if it's hormonal, it's somehow easy to note, because you find that there are those time of the months, you understand, those period times, when you are almost receiving your periods, your face starts reacting, or your chest or your back, wherever your acne concentrates on. Because like my acne, it's mostly on the cheeks and on the chin. So when I'm almost to have my periods, you tend to find I have some pimples, very big lumps. Those big pimples, they don't have anything. You just feel their hand, and they are so painful actually. So I tend to have them during those times. Sometimes my face really breaks, or rather I just find my face is misbehaving. That time my hormones are really not stable at any cost. You can treat acne. There are some of the treatments. I'm not going to go so deep on the treatments, but I will mention various ways of treating acne. To start with, treatments can be recommended at least to help you manage your acne or clear your acne. Some acne are so easy to manage, or even over-the-counter medicines can help you just to clear the acne or to manage the acne. If you want, I do another video on how to maintain a clear acne face, or to clear acne. I can do it. Just comment down below and I will do it for you guys. So focusing on the treatment of the acne, always check the products you are using if they have these specific ingredients, because they are the ingredients known to help cure acne. Those are something like benzoyl peroxide, salicylic acid, something like sulfur, something with sulfur, there is something with alpha hydroxy acids, which have lactic acid. Alpha hydroxy acids are like lactic acid. So any product with such acids will be so helpful to a person who is fighting acne, because what is in these acids that and how does these acids help manage acne? Something like lactic acid will help to remove dead skin cells, that is. It will also help to reduce inflammation. And also it stimulates growth of new and a smoother skin. When you come to sulfur, it also removes dead skin cells and dries excess oils. Remember, acne, mostly oily faces are prone to acne, mostly. So you don't also need that excess oil on your skin, because it may lead your pores to clog very easily. Something like benzyl peroxide, it helps in killing the bacteria, also dries excess oils, and also removes dead skin cells clogging the pores. Something like salicylic acid. I'm not so good in pronunciation, mind you. Just I hope you just understand. But I will link everything that the acids I'm talking about down. I'll link them in the description box so you can go read further there. So salicylic acid, it slows the loss of skin cells and prevent clogged pores. Also it may break down whiteheads and blackheads. So I hope that information will at least give you an overview and the knowledge of what is acne, so that when you see someone's face looking that it's not clear, it has some black spots, it has some whiteheads, maybe blackheads, don't be so inquisitive. Just mind something and understand what is happening with the person. Like, be gentle with the person, because no one wants to have acne on their faces. Everyone wants to slay, everyone wants to glow, everyone needs a flawless skin. But you can't choose anything, but you can control acne. It's a matter of just understanding how to deal with acne and what to do. I hope this video was helpful to someone, and if you need more of this, kindly comment down below and let me know. See you into my next video. Bye bye. God blessings.